Sarah Alali here, product manager for EMHware, and I am your humble co-presenter today. We're super excited to have Maya. And then just some housekeeping. If you haven't used Zoom before, the Q&A function is at the bottom of your screen. So as we're presenting today, if you don't mind dropping your questions in the chat, we'll hold questions till the end, and then we'll review all the questions that you have that you've dropped in the chat throughout the course of the presentation. So that's our quick plan for today. And I think we can turn it back to Jamal or
Sure. So Maya, yeah, do you want to kind of kick off with your part?
Yeah, sure. So I'll reintroduce myself again just to say that while I work on the MHA PDS onboarding full time with Ontario Health, I am technically an employee of Datus at CAMH. So for some of you just might be like familiar with Datus and Catalyst and CAMH. So just sharing that that is my background as well. But Datus is working extremely close with Ontario Health on the rollout of the MHA PDS. And that's why all my slides are also OH branded. So without further ado, I'm going to try to kick off. I'm only on one screen today, so I won't be able to see questions or hands, but I'm sure someone will let me know if,
Yeah, we got you for backup.
yeah.
All good.
Okay, great. And then screen, and then share, and then present. Alrighty. So this is going to be a kind of high level background, both on the recently released operational direction for data submission for mental health and addiction sector, as well as kind of a very high level overview of what it means to adopt and onboard onto the MHA PDS. We'll have our contact info at the end of this short presentation, and we are offering like one-on-one meetings with everyone who wants them. In fact, we hope everyone signs up for a one-on-one meeting. They are with me. So if you have any questions, then I invite you either to email us or book a meeting, and we can talk anything through. Again, some of you may already be familiar with the mental health and addictions provincial data set, but really the first step of onboarding is just understanding what the MHA PDS is. So I will just briefly cover that. We also have a website called our MHA PDS Resource Hub. I'll put links in the chat and send out these slides when we're done. So you can bookmark this and have all this for reference going forward. Some of you may have already seen this, but question number one, what data is actually in the provincial data set? You can see a high level overview here. A few things I like to indicate are that you'll notice that some elements are mandatory, whereas some are optional or conditionally mandatory. So C stands for conditionally mandatory. This means that, for example, when we get into client information, if you don't have a client first and last name and at least estimated date of birth, then like a submission is not technically possible. So that's really what mandatory means in this context. Optional means that your submission will still go through, no problem, if you don't have some of these optional data elements. but they're included in the data set because the Center of Excellence does still believe them to be important to collect. But it's just good to know that most, if not all, of the mandatory elements are data that you are almost certainly already collecting for routine client care. And so from a change management perspective, while some things like the social determinants of health, um, and demographics section, that might be an adjustment. I just want everyone to have full confidence that uh, really our priority here is, understanding things just like client volumes and accessibility. So any data you're able to send from your routine care as part of the MHA PDS is very valuable to Ontario Health, and we really appreciate it. Like I said, you can read like a full summary of each data element on our website. And I'll look in the questions after I'm done, just in case there's anything right now, but that's just a high level overview. Okay, so that's the data that we're expecting you to collect as providers. How does the data get to Ontario Health? This is where EMHware comes in. EMHware is what we refer to as a PDS compliant client management system. So any data in scope for the MHA PDS submission that you input into EMHware is automatically submitted at least daily. In EMHware's case, it's submitted as you go throughout the day, but it's submitted at least daily. And compliant client management systems are also expected to have all the fields in your like workflow screens and front end screens to actually capture this data. So we depend a lot on EMHware to make those technical updates to their existing customer systems to allow users to collect all the requested elements. So that is how the data is submitted. It's submitted at least daily and automatically. And then you are able to see the data you submitted to Ontario Health through a Power BI portal that you'll be given access to as well. Okay, and so then when I talk about in scope, an important thing I think to just clarify, again, this information's on our website. You may be using EMHware to capture data about other programs and services that are not in scope for community mental health and addictions. Please rest assured that only data and clients enrolled in programs under these specific community mental health and addictions functional centers, only that data is submitted to the MHA PDS. Okay, so that's what the MHA PDS is. It's data that we're expecting providers to capture, and it's submitted through your EMHware system automatically. The operational direction is a tool that Ontario Health can leverage with the goal of supporting desired health system change. It is essentially requiring people to comply with the data submission. I think everyone's, familiar with being required to comply with various directions given from Ontario Health and the Ministry of Health. This specific direction has two important objectives that providers are expected to participate in. That is the submission of the data set itself, so what I just went over, and that is also the submission of client OHIP numbers within the PDS. I will also note that there are various functional centers that are exempt from this second point. particularly around consumer and survivor initiatives and family initiatives, crisis intervention, things like that. We also do have the ability of, if a client does not have a health card, if a client does not want to provide a health card in that moment, we will have those exceptions built in as well. The initial scope for this operational direction are community mental health and addictions providers, receiving funding from the Ministry of Health / Ontario Health for community or outpatient MHA programs. In a future implementation, in a future direction, the Center of Excellence will also be engaging with child and youth mental health. Child and youth here, specifically referring to organizations funded through the Ministry of Community and Community Children's Support, MCCSS. I apologize, forgot the acronym. Indigenous health service providers will also be engaged at a later time to ensure that all data governance safeguards are in place before receiving Indigenous data. Okay, there's two important timelines to keep in mind. By the end of this calendar year, really all that providers have to do is submit a plan of how they intend to become PDS compliant. For current EMHware users, this likely just means getting in touch with us through our communication channels that I'll go over in a moment, stating whether or not you'll be submitting this data through EMHware. So it's really just stating your intention, stating that you're aware of the operational direction. And that is the only timeline for this year. By year 2, all providers will be expected to be actually submitting data. Okay. In terms of, so now you know what the operational direction is. How do I actually, comply with this? How do I onboard to the MHA PDS? I have some high-level steps here. Your vendor, EMHware, will be engaged to update your PDS compliance system to allow you to capture all the data you need. Providers at your organization will begin collecting that data. If there's anything new that they're expected to collect, you may have to do some training or change management there. You'll have to sign off on some paperwork with Ontario Health. And then once all those steps are complete, your system will be connected to Ontario Health for ongoing submission. And I always like to note that the first 3 months of your submission is not used for decision making or analysis. It's only used to, kind of assess the health of the submission, make sure there's no big issues, and getting you access to provider reports so you can see what you're submitting as well. I'll send this out. It's on our website as well. It's just some high-level steps that you might expect when onboarding. And then finally, we have how you can get in contact with us. So if this all seems pretty straightforward with you, then you can submit your PDS plan. There's instructions on how to do this on the Resource Hub. It's a support ticket. It's a form that you fill out, and then a case manager looks through your form and, starts the paperwork process, gets in touch, next steps, things like that. However, a lot of the time people want to have a chat before they kind of submit anything official, in which case you can just book an appointment with us and we will walk through the plan with you and answer any of your questions. Finally, you can also contact MHA-DDI at ontariohealth.ca. That email address also goes to myself. So I will answer your questions there. That is my planned presentation. I was trying to keep it kind of concise. I did not see
We do have some
Yes.
questions here, Maya, and yeah, nice work. That was a lot of material.
Yeah.
Thank you.
You're very welcome.
Okay.
Would you like to
Yes.
answer some questions?
I'm just going to rapid fire go through some of them. And okay, I see our MOH funded child and youth mental health services part of this directive. If if you report into the CYMH BI tool, if you are funded through A codes through NCCSS, then at this time, you do not have to do anything in regards to this operational direction or the MHA PDS. If you serve children and youth with community mental health and addictions funding, that is a different story. You will have to begin submitting this data, even if your clients are youth, for example. But if they have those adult, functional center funding, that's really the main determination. And I think I answered, does MHA PDS capture intake for only for OH programs, not for all programs? You can look at our slides and the website to see which functional centers are in scope. A client ID is automatically generated by EMHware. It just appears and it's the same as the MRN. It's just automatically generated when you create a new client record in EMHware and it's submitted to us. And then I do absolutely agree that there should be a French version of the resource hub. We are working through that now, and I hope that it should be ready within the next 2 months or so. But I do apologize that a French version is not yet available. Alrighty. See, another one popped up. Yeah, so there is a really good question about the BI solution. This is why CYMH is not yet impacted by this, but there are plans in the works where you collect the data one time in EMHware, and then EMHware has the lovely job of automatically submitting it both places, both to the MHA PDS and to the CYMH BI tool. But the priority definitely is on not duplicating effort on the provider side.
Yeah, absolutely. And just to hop in there, AJ, there may be some additional work that needs to be done if you're referring to the Inter-I Chime. But of course, Maya just answered in relation to CYMHBI. But yeah, we're working on all those kind of issues and developments as they come up.
Okay,
All right.
think
Any other questions for Maya?
yeah, my plan was to kind of like swoop in, give you the points, and then you have the version of the slides that has all the contact details in it. And then, so I will be signing off now so you can all chat amongst yourselves. But I really appreciate EMHware's time on this, and the person asking about PDS 2.0, you can email me about it. And I will tell you, but it's easier to kind of send some more materials and things like that. So don't be shy. Reach out with your further questions.
So
All
much
right,
for
I'll
your
leave it at that.
partnership, Maya.
Thank
Really,
you, Sarah and Jamal.
Yeah.
Thank you as well. And thank you to providers for performing all of this great work. We really appreciate it.
Indeed. Have a great day, Maya. Ciao. So yeah, happy to have Maya join us for the first bit of her call. I also have a deck to go through. She kind of, as she said, swooped in. So there's going to be a little bit of duplication regarding some of what I'm going to be presenting on, but we're going to as well streamline and enrich and kind of relate it to EMHware specifically. And also, I'll kind of set the bar, considering we do have a question here about MHA PDS 2.0. We are going to be focusing on MHA PDS 1.0 for the purposes of today's explainer, because that is a version that's currently out. But of course, if you do have any questions specifically about MHA PDS 2.0, we will pass on Maya's contact info, and feel free to reach out. And yeah, they're doing some really great work over there at Ontario Health, Datus, and at CAMH. Okay, let me just share my screen here. All right. Do we all are you seeing that, Sarah? Screen? Perfect. Thank you. I've been having some audio issues when doing some screen sharing lately, so always have to double and triple check.
You're
All right,
looking
team,
sounding good.
yeah, perfect. Thank you. Okay, so of course you know both of us didn't have some time to parachute in Maya's headshot and the title and whatnot, but that's okay. She did an exceptional job in introducing herself. So, agenda of what we're going to be talking about. So, high level, we're going to talk a little bit about MHAPS. What is it? Why does it matter? And who's supporting it? We're going to move on to what does the MHAPDS mean for agencies? We're going to talk a little bit about our current EMHware MHAPDS onboarding process, some support and resources, and then we'll address a Q&A as well. And as I mentioned, there will be some slight similarities regarding what we're presenting, but we're going to kind of focus it more on the EMHware experience for the purposes of this presentation. Okay, so what is it? High level. The Mental Health Assessment Provincial Dataset, or the MHAPS, is a new minimum dataset provided and supported by Ontario Health. And I always like to make mention of it being a minimum data set of standardized and harmonized data elements. So version 1.0 is being rolled out right now with a focus on agencies in the adult mental health and addiction sector and related subsectors. And Maya made a mention of an expansion being planned into child and youth. And that's going to be kind of one of the main things that's going to be ushering in as well MHA PDS 2.0. And just so everybody knows, in case we have some folks on the call that are outside of Ontario, the MHA PDS is an Ontario-only initiative. So if you're hailing from BC, the Maritimes, or Quebec, or Alberta, or anywhere else, you don't have to worry about it. But thanks for coming out and learning what we have going on here in Ontario. So a little bit about why does it matter? I think I wanted to take a bit of a stab at talking about why the MHA PDS is actually becoming a thing. I think it's easy for us as a vendor and for all of you as agencies and agency reps, and of course even providers and supporters from Ontario Health and supporting agencies and facilitation agencies to kind of just dive in and say, this is the MHA PDS, this is what it is, and to kind of move on from there. And I wanted to take a moment to take a step back and talk a little bit about the why. Why is this even occurring and why are we doing it? So there is a want and need to have standardized data that supports direct service delivery across the province of Ontario. I'm sure this need and want does extend past Ontario, but the MHA PDS does represent a really interesting opportunity for us in the mental health and behavioral health space to really try and get our standardized, get our data elements in order, try to get our operational definitions in order to ensure that we can get to that place where across agencies and across regions, we can start comparing apples to apples. It's a little bit tricky these days, considering a lot of agencies and a lot of different sectors and subsectors like to kind of do their own thing, either individually or regionally speaking. And I think there is this wanton desire to have data that's consistent and comparable and can provide reliable reporting eventually all across the sector. And of course, it's going to enable system level planners and funders to make more informed decisions around policy, resourcing, and support. And I'm really happy that Maya presented a little bit about the BI solution that is going to be available for agencies, because this isn't only going to be a one-way data street, so to speak. It's going to be an opportunity for you as agencies to be able to assess the data that you're submitting eventually once this BI tool gets fully up and running. And from there, you're also going to be able to glean insights and engage in some data-driven decision making for the purposes of your own agencies and your own programming. And we're more than happy to help you along that journey and kind of power it, if you will, with EMHware tech. So, who is supporting it? Of course, it was created by Ontario Health, and it's supported through several approved EMR vendors, of which EMHware is one. And there are additional organizations working with OH and EMHware to coordinate activities and support agencies. There are various facilitation agencies and consultancy firms out there really trying to help agencies get this off the ground and help make sure that this is built out the spec and that it will be kind of work for the benefit of all of us. So what does MHA PDS mean for agencies? Of course, this will go beyond just a simple 3-point slide. So we're just keeping it, of course, very high level. And for now, with 1.0, adult mental health and addictions agencies will need to eventually submit MHA PDS data to Ontario Health. And this is, of course, securely done through EMHware, of which Maya has mentioned. And we'll go a little bit more into that in a bit. And I'm happy that we talked about the functional center conversation and the plans to kind of expand that over time. But submission does for now only apply to programs that are associated to OH functional centers. And breaking news, Maya did present some timelines to submit along with plans on submission by the end of 2025. So being able to let not only OH know, but as well EMHware know for PM purposes when you do want to begin submitting information to the MHA PDS will be much needed and much appreciated. And it's also great to see Ontario Health and as well us not being prescriptive when it comes to hard timeline submissions. We know that agencies, you have a lot going on, and this isn't a change that is taken lightly. There's going to be some change management and internal stakeholder engagement that you're going to need to do to ensure that you're firing on all cylinders. So how is the data submitted? Fairly straightforward, fair. So agency data collection done primarily through client intake on your end. And of course, as EMHware powered agencies, you enter in new clients quite regularly, either through new client addition functionality or of course through case data or however it is you take care of your intake solution. And the data is input into EMHware. So all necessary data elements are already built into the platform. They're built into our code stack. So it's just a matter of configuring it on and off in terms of what is needed. And then submission does occur. It is auto submission that is sent to OH regularly all throughout the day. And for us, like minimum, as Maya mentioned, daily. And that's, of course, sent in securely on the back end with not much impact on front end systems. So a little bit more about the data. I'm really happy that Maya talked about the mandatory, optional, and conditional aspects of the data elements. That was something I was going to chat about. This is one of the most common questions I get about MHA PDS data. And she did a pretty good job of breaking it down. So, of course, mandatory elements must be collected and submitted. And within EMH or within our solution, anything that's mandatory within a screen or let's say within a new client screen as you're doing intake, that's an emboldened field. So anything that you, of course, see in bold within EMHware, that is kind of a mandatory thing that needs to be inputted or filled out on that screen. So within the PDS are as well a bunch of optional elements, and Maya showed you the big old slide with all the different elements. Those elements are up to the agency as to whether or not you want to collect and submit this information. Of course, when it comes to optional elements, it really comes down to balancing out between, intake/admin burden as well as collecting relevant data for the purposes of your own programming. I think it's pretty neat that OH has built in a lot of really interesting optional fields within the MHA PDS 1.0, and there are plans for expansion to 2.0. It enables you as an agency to collect more data that you could potentially use for future reporting and future decision making. And of course, you also have conditional elements, and those are dependent on another element. They can either be mandatory or optional in nature. So one of the main examples I like to give are referrals. Of course, depending on whether, of course, you accept, authenticate a referral, and process a referral within EMHware, there will be new kind of a branching selection, if you will, determining whether or not what type of data comes after, depending on the choice that you make regarding the referral. So hence why it's conditional. All those kind of subset data elements are conditional depending on previous choices that you make and previous data that you input. But there are, of course, other conditional elements outside of the referral suite of data elements. Okay, a little bit about our current EMHware onboarding process. As things update and as things move on to 2.0, this will probably be subject to change. We're aiming to add a little bit more streamlined things on the back end to make it even a more streamlined process. But right now, we kick off with an intro call with an EMHware rep. So we end up chatting with you, answering any questions that you may have about the MHA PDS. We go through some of the optional elements, and as well, we send you some resources. We're trying to do what we can in terms of alleviating concerns, answering questions that you may have regarding the MHA PDS. So we're here for you as account managers and as support folks over here at EMHware. We just want to make sure that you're set up for success as much as possible. And one of the main outputs of the intro or call is to engage in a data validation exercise. So next step is we receive your consent as an agency, and then we work with the folks at Ontario Health as well as our own internal dev and product teams to collect the necessary connectivity data, basically building a pipeline from your dedicated EMHware server and instance all the way to Ontario Health. Normally, data validation, the actual crux of it will take 4 to 6 hours. And we end up just trying to assess and build a pipeline between EMHware to Ontario Health to ensure that we can actually submit the data. So it's a very important step. It, in essence, kind of without data validation, we can't technically actually build that pipe to submit data from your instance up to Ontario Health. And from a technical perspective, after data validation is a go, your agency is able to go live and begin submitting. And then it becomes up to you as an agency in terms of when you want to start submitting. From a technical perspective, an agency can start submitting to the PDS after data validation is passed. But as an agency, you might have a lot going on. You might want to engage some internal stakeholder management and engagement. You might want to engage in some internal training, or go through a comprehensive change management process. Whatever it may be, we meet you where you're at regarding when you want to choose to start submitting to the PDS. So this is also another common question I get from agencies and folks, like when should we start submitting? Again, after data validation, technically speaking, you can start submitting. It really comes down to you as an agency in terms of your readiness and when you want to start submitting. Okay, some resources. So Maya did a great job in showing some of the resources that are available, including the resource hub, and we'll be able to send all this out to all attendees after this webinar. Another resource that I also like to mention is that we have a vendor mapping template. So this is specific for EMHware powered agencies. So on this vendor mapping template, it's essentially an Excel workbook. And on the main spreadsheet within the workbook, it essentially ties EMHware screens and data elements to the MHA PDS. It also does a good job of giving you kind of like a bird's eye view on all the mandatory and optional and conditional fields, in addition to providing the definitions that are, for the most part, pulled from the data dictionary. So Between these three resources for 1.0, you should be relatively set regarding having everything you need to get a pretty in-depth understanding of what the MHA PDS is about. And of course, if resources or referential resources aren't your thing and you want to hop on a call and chat about things, you know where to find us over here at EMHware. Okay, that's my presentation. Curious if we have any questions.
Great job, Jamal. I see some questions in the chat, and some of them might be helpful if I answer from a product perspective, if that's helpful for you, Jamal.
Sure, love it.
All right. So a couple of these sound like mm, they're from agencies who haven't yet onboarded 1.0. So I'll start
Okay.
there. And then the overarching question is what to expect about 2.0. I'll kind of finish up with that one. So first, the question is, changes to intake front end is only for the programs covered or all programs for which we use EMHware? The answer is today, how it's built is that if you've turned on MHA PDS 1.0, if you've turned on MHA PDS 1.0, you're going to see those fields available for all programs. But we will be changing that in EMHware for MHA PDS 2.0. So based on the program that the client is enrolled in, it will either display the MHA PDS required fields or potentially display them as optional. And I'll also make note that it's still under design for MHA PDS 2.0 and EMHware. So your feedback and your questions help us kind of guide and prepare to ensure that what we're building is the most streamlined data entry to kind of hold in harmony the various submissions your agency might be responsible for. So to answer your question, now it will be displayed for all programs. In the future, we'll be able to streamline that better. The next question is for the optional fields. Are we able to decide if we want to submit them, or does it automatically get submitted if it's entered into EMHware? And the answer is they will get submitted if they're entered into EMHware, as long as there are no indicators that the client falls under one of the, well, specifically Indigenous. So the MHA PDS team is not yet ready to ingest Indigenous data, and therefore EMHware filters out the data from those submissions. MHA PDS replaces the old CDS, correct?
I got some insight here.
Okay, thanks,
Yeah,
Jamal.
yeah, no worries. So, Carl, great question. And this isn't the first time I've been asked this question in a 24-hour period. So it's quite topical. So here's the thing. We don't have guidance yet on what the actual plan is regarding CDS. I think one of the things that we need to be mindful of is that the MHA PDS, as we mentioned, is a minimum data set, and it does have this aim to harmonize and standardize data elements for the mental health sector and subsectors all over Ontario. So we know that. And the CDS, as we know, is a version of that per se, but it's a bit aged. So when it comes to replacing the old CDS modality, one, we haven't heard anything yet from Ontario Health as to what the guidance is there. But also, we need to be mindful of when you're talking about replacing or retiring, if you will, or sunsetting other data sets, there's a lot there, right? Because there are a lot of agencies that sometimes are still inputting and still using CDS reporting, let's say for internal purposes, whether or not they are or are not submitting CDS reporting. So, We haven't received any guidance on CDS being sunset or being retired at this time, and whether or not MHA PDS will be replacing it. But I do think, though, uh, that is a very topical question. Like I said, it's something that is consistently being asked, and we have as well brought it up to the attention of our partners over at Ontario Health and other facilitation agencies.
Thanks, Jamal.
No
Appreciate
problem.
that. The next question is kind of dovetailing off a previous one. Will the non-included programs be able to save their intake without the PDS mandatory fields? And the answer is for 2.0, yes. You will be able to save your intake without PDS mandatory fields. And then coming back to the overarching question about what to expect with regard to MHA PDS 2.0. Namely, Ontario Health is seeking to do a lot more standardization than they had done in the first pass of MHA PDS. In summary, we have a ton of data that would be found in things like the client's program history. So very similar to other submissions, what they're observing is the utilization and throughput of clients throughout the various functional centers over the course of time. Another important element of the MHA PDS that they'll be seeking to, so going back to program history, not many changes there. EMHware is already mapped very straightforwardly with regard to the continuity of care that they're seeking to observe as it relates to health service events, is what they refer to them as for MHA PDS. Where you're going to see the most differences is related to 3 areas. The first area is relevant to all of us, and that's the social determinants of health. MHA PDS is seeking to add more standardization and specifically aim to be more inclusive in how we're collecting social determinants of health and observing those at the systemic level. That's probably the biggest impact area you would see changes. And what that will look like functionally from an EMHware perspective is we seek to find a harmony between standardization and configuration, and most of these fields will be built into the client data set as it relates to social determinants of health. The 2 subsets of other areas that will see the biggest impact is substance use and problem gambling for MHA PDS 2.0. So with regard to substance use, they are going to require us to ask a couple specific questions as it relates to recovery medications and whether recovery medications had been prescribed or offered to the client and declined. One thing to note here is we are bound by the MHA PDS to ask the question as they have directed us to ask that. So unfortunately, we will not be able to leverage our medications module, for example, to automatically send the submission. We are bound by MHA PDS to ask very straightforwardly, was this client offered recovery medications? If so, what medications were prescribed? So that's one element of substance addiction. So anti-craving medication for alcohol use disorder and opioid agonist therapy for opioid use disorder. As it relates to problem gambling, this only impacts people. Oh, and the substance use questions are only related to substance use functional centers. So those are conditional on the client being admitted to a substance use specific functional center. Similarly, for problem gambling, only programs that have an associated functional center to problem gambling will be required to answer a couple questions. And essentially, there is a problem gambling assessment that EMHware will be building. I can't confirm the placement of that questionnaire yet, but if the client is in the in a problem gambling program, EMHware will have a questionnaire that should be filled out for every client in the problem gambling program. And that is kind of it's a standardized assessment, and the name escapes me, but it is looking at it, it's about 12 to 15 questions. So those are the key changes for MHA PDS 2.0 on the data entry side. Along with MHA PDS 2.0, we're also going to have a data quality report suite that that we got feedback from our clients over the course of the 1.0 implementation that it would be beneficial to have. So you'll be able to review historically any submission information, whether they were successful, whether they were failed, and the ability to manually push a resubmission if a certain error had been rectified in the client file. Finally, and this is probably mostly relevant to those of you who already have MHA PDS 1.0. Right now, upon saving, it submits to MHA PDS. So as your staff are working through the client file and saving certain elements, EMHware is pushing that data live throughout the course of their workflow. And you're getting feedback immediately as to whether the submission had been made or not. EMHware has the opportunity to improve some of our error notifications. So some of it can be a bit confusing or even concerning that there was a submission error that otherwise should not be concerning. So no one was doing anything wrong, but you're getting an error. So we're looking to optimize our error messaging. And secondarily, it will be more like a report queue process so that essentially the submissions are going to occur in batches after hours, as opposed to submitting little packets of data throughout the course of the day, which was a requirement from MHA PDS for the 2.0 implementation that EMHware must adhere to. That's my long story short or long story long, depending how you spin it. I'm not seeing any other questions in the chat.
Yeah, it seems like we're all done on questions. First call, questions. Any more from anybody?
We need the auctioneer voice now.
Oh,
Can I get a question? You got a question? I got a question.
My throat. Oh, any downtime expected? We did get a question come in.
That is a good question. So the answer is no downtime is expected insofar as we are required to support both the 1.0 and the 2.0 requirements simultaneously so that we have more control over change management, which means that 2.0 will be built and live, kind of living behind a configuration for your agency, and it would only be turned on at the time you're ready to go live. So because of that, no downtime is expected because it will come out in our typical release cycle. Other questions?
Second final call for questions. We got quite a few today.
We did.
Third and final call for questions. looks like we're good.
All right. Well, thanks everyone for joining us today. We're always here to answer more questions if you think of anything outside of this call. Secondarily, we'll be sending out some follow-up materials, including the PowerPoint that Maya shared, so you can get access to all of the important resources and links that she has available. As always, we're here and available if you need us after the call. So looking forward to partnering with you all on implementing and continuously improving the MHA PDS when your agency is ready. Um, and as always, appreciate your partnership and the time that you spent with us today. Jamal,
Definitely.
anything else?
Oh, no, couldn't have said it better. You all take care of yourselves. Again, as Sarah mentioned, feel free to reach out if you have any questions, and we'll be in touch with follow-up resources. So thanks all for joining us for today's Lunch and Learn. Our final Lunch and Learn is going to be next Tuesday, and we're going to be capping things off on this Lunch and Learn webinar series talking about our payment processing as well as contract module solution. All right, well, if you're going to come on out, until then, take care. Have yourselves a great weekend.
Thank
Bye-bye.
you. Bye.